Do you have chubby cheeks? Well, if you do, then there is an option for you to treat it that's quite easy. But before we get into that, let's talk a little bit about exactly what chubby cheeks are and what parts we can improve. So the cheeks, basically, as plastic surgeons, we look at the cheek in kind of two separate locations. There's a cheek that's up here that we typically want to add volume to, because as we get older, our cheek bones and the front of our cheeks do tend to lose volume as we age, and adding more volume to it using either your own fat or using a filler is a very, very common procedure. But where people don't like chubby cheeks, where it's actually too much a lot of times, is as they get older, they find that this part of the face, the lower face or the cheek hollow, becomes too full. And the best way to feel exactly where that is if you bite your teeth down and grit your teeth nice and tight, and you can feel the masseter muscle, which is a thick muscle on the side of your jawline that kind of comes up here towards your ear. When you're biting down, you're clenching your teeth, it's going to feel real hard, and right in front of it there should be a bit of a hole that you can literally put your finger into. That's the buccal space. And the buccal space contains a pad of fat that's about the size of a gumball called the buccal fat pad. Now this piece of fat on each side of our cheek, inside that cheek hollow, is there when we're babies that help us to suckle and suck off of a nipple, basically. And as we get older, and some people like myself, that buccal fat all but pretty much disappears. But in other people, that buccal fat can actually stay large and even enlarge potentially in some people, and can even herniate through the muscle covering over it. So sometimes I'll even see people that have this puffy area right in the cheek hollow where it sticks out, and that's typically a herniating buccal fat pad. Okay, so if you don't like the fullness of your cheek hollows, then we can reduce the fullness of the cheek hollow by removing that buccal fat pad. So you see here, I'm going to point this way, you can see where that arrow goes to on the screen. That's her cheek hollow, and it's a little bit full on her, so by removing fat there, we can help to contour those cheeks in. In plastic surgery, we call it an OG, O-G-E-E. It's like an S shape, and ideally we want the cheeks fuller, and then we want it to ideally kind of curve in where you have the cheek hollow in kind of that S-shaped fashion. If, however, the cheek hollows are too full, then it causes our face to look square or even bottom heavy. And that's where the buccal fat pad removal comes in handy. So how do we do a buccal fat pad removal? Well, basically it's very simple. If it's not combined with another surgery, or if it's not combined, well, technically it's not combined with a facelift, then it has to be removed from the inside of the mouth. So typically I do it under a general anesthetic where you're completely asleep. While you're asleep, I take a look, we clean out the inside of the mouth, and right inside the actual cheek itself, I'll make an incision near where your molars are. And after making that incision through the mucosa, the covering of the mouth, there's the buccinator muscle, which is a very thin sheet of muscle that covers that. I kind of tweeze through it, and right there should be that buccal fat pad. It's a glistening yellow fat pad basically on each side. So we will kind of spread through that muscle, grab that fat, and literally gently pull that fat out. The fat is removed. A couple of absorbable stitches are put on the inside of the mouth, and you stay on a liquid diet for about a week afterwards. Now, the good thing about removal of that is that there's no visible scars from it. Okay, and so typically it heals great. People do have to stay on a liquid diet for about a week afterwards, because the last thing you want to do is put a potato chip through that incision. But you stay on a liquid diet afterwards. People don't need any pain medications typically. The area will swell a little bit, so it does take a few months for all that swelling to come down, and usually you'll see a result within about 3 to 4 months. Now, how much of a result you get is the big question, because everybody has a different amount of buccal fat. And just because you may have chubby cheeks down here, it doesn't mean you're going to have a ton of fat that we can remove. It is a bit unpredictable. So I tell my patients that it's about the size of a gumball, but it can be the size of a penny gumball, or it could be the size of a quarter-size jawbreaker or a 50-cent size jawbreaker. And obviously we hope it's going to be bigger rather than smaller, but we don't know until we actually go in there. we take the fat out, and it just helps to kind of contour this part of the face. And you can see in this picture right here, the before and after, where the cheek hollow definitely is a little more contoured right in this area for a nice improvement from that buccal fat pad removal. So the recovery, once again, is very simple. Liquid diet for 1 week, no pain pills or anything like that. Should see the results hopefully within just a couple of months as the swelling comes down. The risks of surgery, the first thing really is maybe not seeing much of a change at all. You know, you may look at it and we just may not find a whole lot of fat, so you may not get much of a change. Typically with the buccal fat removal, the biggest changes are still considered moderate. So what I tell patients is either a modest to moderate change. It's not going to be a severe or dramatic change. It just doesn't quite, it doesn't have the power to do that. So the first risk is that you're not going to see much of a result with it. Another risk is bleeding. Okay, I have seen that once or twice back during my fellowship in California, but very, very rare complication. Infection's always a risk with any surgery, although very, very low with this. There's a salivary duct that goes right around in that buccal space, and so there's risk of damage to that salivary duct. There's also blood vessels and nerves that go through there. There's risk of damage to the facial nerve, of which a branch goes through that buccal space, although extremely uncommon to damage it. And there's risks which are very small that it's going to be overdone. The people that we don't recommend buccal fat removals are people with very skinny faces, because it can skeletonize a face, and as you get older, it can potentially make you look prematurely older if you've got a thin face. However, if you're the type of person that's always had a heavier, chubbier face, and or you've got that buccal fat that's protruding, then it can be a very, very useful procedure to do that. Now, I mentioned earlier that we do it through the inside of the mouth in everybody who hasn't had a facelift. Sometimes when I do a facelift, I can see that buccal fat protruding, and we can remove it through the facelift approach. The good thing about that is you don't have to go on a liquid diet for a week, okay? But sometimes you can see it that way, sometimes not. It depends on if the muscle covering it has thinned out enough that it's actually protruding, in which case it's a very simple way to remove it, okay? But most of the time you have to go through the inside of the mouth. Here's another example. Now, this is a patient who came in to see me who said he didn't like the shape of his face. And he felt his face was too bottom heavy, and he wanted to add more of the cheeks and make his face look what he felt was more masculine. So by removing the buccal fat pads in the lower part of the face and adding fat into the cheeks and the cheekbones, I was able to reshape his face to give it a bit more of a OG, meaning the fullness above and kind of thinning out down here, and what he felt was more of a masculine appearance. I also put some fat into his chin too, which also helped as well. This is a great case for a buccal fat removal. You can see she has what we would consider a bottom heavy face with some jowling. She underwent a facelift, but I also took her buccal fat pads out, which helped to thin that lower part of the face. And you can see it really helps to kind of reshape the face, to thin out the cheek hollow, to give her a much nicer, more youthful shape. And another example as well of somebody who felt her face was a bit bottom heavy. We removed the buccal fat pad, also did some liposuction under her chin to thin that area out too. But where you can look at for that buccal fat removal is you can see that her cheekbone, I'm going to turn this way, that there's a nice shadow coming down here that she did not have before, and that's removal of the fat right in this area from the inside of the mouth. So that's the best way really to treat the chubby cheeks. Some people ask, well, what are the other options? Can you liposuction the face? Wouldn't that make sense? Yes, it would, theoretically, but what I find when you liposuction the face is that people can get a profound amount of swelling there. You also have risks of unevenness of the face afterwards, of little channels that you can create by the liposuction cannula that could be visible in the surface of the skin. So I do not recommend liposuctioning the face. So that's not a good option. The other thing you can do is inject some Botox into the jawline. That's not the cheek, that's kind of way back here. Okay, I'll turn my head so you can see. Injecting Botox into that masseter muscle, the one that you grit your teeth and you can feel really hard. Injecting Botox into that muscle can help to actually narrow the face back here, but it won't do anything for chubby cheeks. And typically we don't try to remove chubby cheeks up in this area, the cheekbone area, because that's usually what keeps you looking young. So removing fat from the inside of the mouth here, injecting some Botox kind of in the jawline here, which if you're more interested in more about that, check out the lower face section where I do talk about kind of a wide jawline and how to treat it. That's with the Botox. But those are the two ways to do it, and I don't recommend liposuction. So I hope this was helpful for you. If you're suffering from chubby cheeks, if you don't like your chubby cheeks, consider a buccal fat pad removal. I think that's a very reasonable procedure with some modest to moderate results depending on how much fat we can remove. Thank you very much for watching.